Cheers everybody, Chad from the Move Lab. I got my buddy Steph here from Male Frame helping me out with this next one. We're going to go over some hip CARs. Now, CARs as a term is an acronym for controlled articular rotations, which is a fancy way of saying we're going to be doing some joint circles. So why do we want to do joint circles? Well, as we know, motion is lotion for the joints, movement is the best thing you can give your joints, and rotational movement in particular is the purest form of your articular function, of your joint function. So you're going to be able to carry your joint, whether it's your shoulder or your hip, through its fullest expression of its range of motion. Now, when you do these, the idea is to trace the circle as wide as you can, as slowly and as controlled as you can. So you want to challenge your joint to expand its range of motion, to produce movement within the outermost limits of its ranges. In doing so, you're giving yourself a nice tool for self-assessment. So when you progress through these rotations, you're going to be able to assess your joint and you're going to be able to know exactly where you need to do your work. So as you trace your circle, if you experience any restriction or any pinch or pain in a particular range of motion, you know exactly which areas you need to target. So Steph's going to come into a tabletop position. So there's many different ways that you can do these. We can go over some different variations. For today, he's going to do them from his tabletop. Now the idea here is to isolate the hip joint. So we want to be able to prevent any potential compensation. So compensatory patterns or patterns of compensation is your body, when you give your body a command of, I want to trace this circle as wide as I can, it's going to do whatever it needs to do to accomplish that for you, even if it needs to cheat a little bit. So to begin, Steph is going to start to bring his hip into extension. So he's going to begin to kick up and back through the heel of his foot. As he kicks up and back through the heel, or as you begin to find your hip extension here, you just want to make sure, you want to become aware of what the low back is doing. So we don't want to allow the low back to overarch to get more lift in the leg. We want to try to keep the spine as neutral as possible. So as you press up through that heel, you should be feeling some good activation of the hamstring of the muscles through the back of the thigh. From here, he's going to start to roll his hip open. So he's going to create external rotation, in other words. As he rolls his hip open, he's going to try to actively abduct, or in this case, just lifting away from the ground as he pulls his knee forward. As maybe an internal visual, you want to think about trying to draw your knee towards your shoulder, your armpit, or maybe to the elbow, whatever your capacities. And as he pulls in, he's slowly going to close that hip up. He's going to draw the knee and thigh underneath the chest, coming to his hip flexion here. So go for another one. Now when you're doing these hip CARs, you want to do 2 or 3 as slow as you can go, as wide as you can make it, in both directions. And so he's working really hard here to hold the rest of his body solid so that he can be sure that the movement he's producing is coming from that hip. You got it. And then we'll go one more in the opposite direction. So he's going to start by drawing the knee in towards the chest. He's creating hip flexion here. So you want to feel that squeeze through the front of the hip crease. From here, he's going to begin to abduct and externally rotate the hip, lifting away from the ground as he swings the heel back and up towards the ceiling. You got it. Nice. Begin to get a little bit more accustomed with the movement. Your nervous system, your body is able to coordinate it a little bit better. We can also sort of level up these hip rotations by using props. So you can use your tennis ball, lacrosse ball, whatever you have. You're going to bring it behind the knee. Yep, and the idea here is to squeeze on that ball. When you squeeze on that ball, you're going to be activating more of the musculature surrounding the hip joint. So you're going to be able to squeeze a little bit more strength and a little bit more coordination out of the joint. This also helps to create afference. So this idea of afference or afferent feedback is information coming from the joint into the central nervous system. And so as we squeeze on that ball, we're creating more engagement, we're creating more afferents because we're getting more of the mechanoreceptors or the sensory receptors within the capsule of the joint, so that's the deepest part of your tissues. You're getting more of those little sensory receptors firing, and that's going to give the nervous system better quality information, clearer information.
Wow.
Nice. And so the more information that the nervous system has to work with and the better quality that information, the better your body is going to understand where your joint or where your limb is in space and how to be able to move efficiently and effectively and safely through that space.
It's more difficult on the reverse.
Yes.
A lot more difficult.
Now as you're doing these as well, if it becomes a little bit too much for the wrist, just know that you can always go for knuckles, or just take little breaks every once in a while, give your wrist a little bit of a break and then come back to it. Another thing to help you really isolate the hip and to anchor the rest of your body down, personally I like to tuck my toes under and I'm going to push down and back through my hands. So I really feel myself rooting down through the toes. I also like to flip my fingers to point away from one another. And as I push down into my hands, it's like I'm trying to spread the floor apart. So that's going to help me to irradiate even more. And so that's going to create more muscular engagement through the arms, through the abdominals. Again, the more muscular engagement, the more contractile force you can generate from other areas of the body, the more amplified the signals you're going to be sending to that hip. So I find my hip extension, the hamstring is talking to me here. I'm going to start to roll that hip open. So I roll the hip open. I'm actively trying to lift away from the ground as I draw the knee forward. I'm going to try to reach that knee to the shoulder or the tricep before I adduct, before I draw in towards my center line. And then I'm going to change directions. Knee to chest without letting the spine round. I want to feel that squeeze through the front of the hip crease, and then I'm going to open it up. As I externally rotate and abduct here, opening that hip up, I want to make sure that I'm not bending elbows to create more lift in the leg. I want to make sure I'm not leaning into the opposite hand, opposite knee. So if you notice those little tendencies starting to creep in to your movement, you want to pause your movement, correct the compensation, and then continue.